So, Dr. Tam, removing the global emergency status for COVID-19, what does it really mean for the virus, the cases, and the vaccine intake? Where are you on this?
Well, I think today is an important milestone to mark at the global level, where there's a transitioning from an emergency crisis response to one of ongoing management of COVID-19, because this virus, the SARS-CoV-2 virus, is here to stay in the human population for the foreseeable future. So I think that's what that announcement means. In terms of the reason behind the announcement and what's going on in Canada right now is, for about the last 6 to 8 months, even as the virus is mutating and still circulating, we're not seeing the big up and down waves that we were seeing at the initial years of the pandemic. So we've reached a more steady state. The virus is still circulating in quite a significant way, but we're seeing hospitalizations stabilizing, even though over 2,000, between 2,000 and 3,000 people still in the hospital per day with COVID-19. The number of deaths per day is tragically still at over 10 a day, but has also stabilized. And the number of people in the ICU has decreased and stabilized. So with all of those factors taken into account, I think transitioning to how we're going to manage this condition and the evolution of tracking the evolution of the virus needs to move into a more sustained approach.
So, is COVID-19, Doctor, I mean, you've been at the helm of this from the very beginning. Is COVID-19, if I'm understanding correctly, not a major threat in Canada anymore?
I think, as I said, the virus continues to circulate, so we have to remain vigilant. It is still a significant challenge, particularly for those with high-risk medical conditions or who are seniors. So it is not an insignificant health challenge, but we should be managing no longer as a crisis, but more as an ongoing illness that wasn't there before, but is now with us for the foreseeable future. So I think right now our attention is to continue to prepare, for example, towards the fall, getting the necessary evidence to look at what our next set of vaccine recommendations should be. Right now, of course, the National Advisory Committee on Immunization has recommended a booster for those at the highest risk in the spring period. So I think it's still a period of ongoing learning. We must also continue to solidify our gains and strengthen our health systems writ large in order not only to address COVID-19, but for other potential emerging viruses. And as you've seen in the fall and winter period last season, COVID-19 was beginning to stabilize, but you got at the same time influenza and respiratory syncytial virus. So we got to look at all of these viruses together, because together they will have a significant impact on our healthcare system.
Dr. Tam, may I ask, well, of course, you have spoken about how we we have to remain vigilant when it comes to COVID-19, but talking about the future in terms of preparedness, we never know what sort of a virus may pop up. What have we learned from COVID-19 and this pandemic to prepare us better for the future?
Well, I think there are many lessons learned, and so I think we've been saying in the public health world that a pandemic's going to come. It's not a question of whether it will come, but it's a question of when. So again, even as we're coming out of this crisis phase, we must remain vigilant. There are other viruses that we're keeping a very close eye on, such as Mpox, and also the evolving avian influenza H5N1 situation. So we must keep up and strengthen our monitoring systems. As I've said, we've strengthened genomics surveillance, we've strengthened laboratory diagnostic options, we've strengthened wastewater surveillance. All of those infrastructures and systems, if we don't let them go away, if we keep up with them, will allow us to better detect at the earliest instant the emergence of any global health threat of the future. But also, of course, as we all know, there's significant capacity issues in the health system, whether it's on the public health side, but certainly on the healthcare side, which has been discussed quite significantly in the last months and years. Our healthcare workforce and how our hospitals, our primary care needs to be strengthened. And most of all, I think because we failed some of populations most at risk, such as seniors, those who work in certain essential industries, such as agricultural workers, personal support workers, we know that in future pandemics, the same populations that may be experiencing equity concerns throughout in between pandemics will be the ones who will be impacted the most. So I think in our preparedness plans, we must take into account these more targeted and supportive measures so that people in all communities, no matter where you are, who you are, can access the necessary protective and treatment measures that you need.
Some great points there. Dr. Theresa Tam, Canada's Chief Public Officer of Health. Appreciate you taking out the time, and thank you for speaking with us here on CTV News Channel. Appreciate it.
Thank you.